The proposed reproductive health care bill has brewed a storm amongst legislators and the public, saying it was a free ticket to immorality for children as young as 10 years. During a public debate set to engage members of the public on their opinion on this thorny issue, divergent views were shared. The bill, that is sponsored by nominated Senator Judy Sijani, seeks to give a framework in which the country's healthcare is set to operate from. Various stakeholders sought to raise issues on the bill that many have misunderstood, as will distribute condoms to school. The author of the controversial health bill has refuted claims that her bill seeks for the distribution of contraceptives to school-going children and challenged people to point out to the section alluding to that.
What is your understanding of reproductive health care services? Does it entail only about sex, or there are other issues or changes within the children that do occur that they may need to consult on? And reproductive health services, do they include other services like counseling, for example, information? Why are you narrowing it only into sex and distribution of contraceptives?
Section 33 of the bill on reproductive health of adolescents sparked a heated debate on the issuance of friendly reproductive health services to adolescents aged 10 years to 17 without parental consent.
We are proposing that the bill be amended on clause 33(1) by inserting the following words immediately after the word board. After the board, it's very, very important that you need to consult the parents. We cannot agree our children to go outside there without the consultation of the parents.
This many raised an issue, saying the country should interrogate the cause of children engaging in early sex.
Why do children engage in sex? Are we going to deal with those causal factors of abuse, low self-esteem, and other things like that? Because if we don't deal with the whole person, we'll find ourselves in a very serious trap where it will be more contraception on more contraception, and the person is damaged emotionally and in other ways.
Saying if not dealt with, we would, as a nation, grapple with consequences of the contraceptives.
We as leaders have to demonstrate sexually responsible behavior. It is not really acceptable that we say in this country our children are engaging in very irresponsible sexuality, because it starts with us as parents, it starts with our public leaders.
The bill was alleged to go against the Children's Act, saying the sole responsibility of a child was on the parent to give guidance in the decision-making process and not the child.
The Children's Act is a bill that is critical when you're looking at all these things, especially the issue of parental consent and the issue of parental guidance, to give moral guidance, to give spiritual guidance to our children.
Old adage that prevention is better than cure still stands, okay?
The bill was attacked, with drafters alleged to have sneaked in a controversial section of the Constitution on abortion.
There were key constitutional issues, Article 26, and the church raised serious issues about Article 26. And to sneak this bill, this issue through the reproductive health bill, is an issue that we need to reconsider and look at.
This was defended by the Senator Sijani, who is the sponsor of the bill.
Are you aware of the government's adolescent reproductive health development policy? Are you aware that there's a policy already in place? And are you aware that it is already implemented, that the government these children actually do access contraceptives through the government and other health institutions?
The chair of the Senate Committee on the Reproductive Bill supporting.
We also need to address the real issues that are facing us. They are real issues, and I don't think we can ignore it anymore. So there has to be some negotiation here.
Some seeking to recall the bill since it did not meet this threshold.
Kenya as a nation, then it would be very sad that this bill will go through without us discussing the issue.
Exactly is comprehensive sexuality education. What does it entail? Because it could also mean, it could include issues like masturbation, it could include different sexual behaviors. So if it's not defined there, then it's prone to abuse.
Others question the issue of surrogacy, saying even in some developed countries, it had been prohibited.
There are issues that are being introduced that the Kenyan people must be able to understand and be able to digest before it is passed. The issue of surrogacy. We want to know the ramifications of this. Is there a national policy in relation to this? What are the legal consequences and potential outcomes of these arrangements?
As the reproductive health bill goes through its formal stages, many are yet to see whether the legislators will tear into the contentious issues, including abortion. Winnie Kamau, African Voices, Nairobi, Kenya.